Welcome, fellow travelers, to an exciting journey through the intricate pathways of the cardiovascular system. In this comprehensive guide, we will embark on a step-by-step exploration, equipping you with the knowledge and skills to assess and understand this vital system. Join us as we unravel the mysteries, uncover the secrets, and navigate the fascinating world of the heart, blood vessels, and circulation. First, anatomy and physiology of the cardiovascular system. In this chapter, we will lay the foundation for our journey by delving into the anatomy and physiology of the cardiovascular system. From the heart's chambers, valves, and electrical conduction system to the network of blood vessels, we will explore how this remarkable system works to transport oxygen, nutrients, and waste products throughout the body. Second, assessment techniques. Prepare to learn the essential techniques for assessing the cardiovascular system. We will guide you through the art of inspection, palpation, percussion, and auscultation, demonstrating how each technique provides valuable insights into the heart's function and the condition of blood vessels. You'll develop the skills to detect abnormalities and recognize normal findings during your assessments. Third, gathering patient history. Every journey begins with understanding the individual stories of those we encounter. In this chapter, we'll explore the importance of gathering a comprehensive patient history, including risk factors, symptoms, and past medical and surgical history. Discover how these pieces of the puzzle contribute to a holistic assessment of the cardiovascular system. Fourth, vital signs assessment. Vital signs serve as our compass, guiding us through the cardiovascular landscape. We'll teach you the art of measuring blood pressure, heart rate, respiratory rate, and temperature accurately. Understanding the significance of these vital signs will enable you to identify potential cardiovascular issues and monitor patients' overall health. Fifth, peripheral vascular assessment. Embark on an expedition to the peripheral vascular system, where we'll focus on assessing pulses, capillary refill, edema, and temperature and color changes in the extremities. By understanding the importance of peripheral vascular assessment, you'll gain valuable insights into blood flow and vascular health. Sixth, jugular venous pressure, JVP, assessment. Journey to the heart's gateway as we explore the assessment of jugular venous pressure. You'll learn how to assess JVP and interpret its findings, providing clues about right heart function and volume status. Unlock the secrets hidden within the neck and master this vital assessment technique. Seventh, blood pressure measurement. In this chapter, we will dive into the world of blood pressure measurement. From the traditional cuff method to invasive monitoring, we'll guide you through the techniques, pitfalls, and interpretation of blood pressure readings. Understanding blood pressure is crucial for assessing cardiovascular health and detecting hypertension or hypotension. Eighth, heart rate and rhythm assessment. The heart's rhythm is the symphony of life. Join us on this chapter's adventure as we teach you how to assess heart rate and rhythm through pulse palpation and electrocardiogram, ECG, interpretation. You'll become skilled at recognizing normal rhythms and identifying potential arrhythmias. Ninth, auscultation of heart sounds. Listen closely as we explore the enchanting world of heart sounds. We'll guide you through the interpretation of the first and second heart sounds, S1 and S2, and help you recognize extra heart sounds and heart murmurs. Through this auditory journey, you'll develop the ability to detect abnormalities and understand their clinical significance. 10th, carotid arteries assessment. Venture to the neck and embark on an expedition to assess the carotid arteries. Discover the techniques for palpating and auscultating these vital vessels, gaining insights into blood flow to the brain and potential stenosis. Mastering carotid artery assessment is essential for evaluating cerebrovascular health. 11th, assessment of the abdominal aorta. Our journey takes us to the depths of the abdomen as we assess the abdominal aorta. We'll teach you how to palpate and auscultate this significant artery, identifying potential aneurysms and ensuring timely intervention. Understanding abdominal aorta assessment is crucial for detecting life-threatening conditions. 12th, electrocardiogram, ECG, interpretation. Unleash the power of the ECG as we guide you through the interpretation of its waves, intervals, and segments. You'll learn to recognize common rhythm abnormalities, conduction disturbances, and signs of cardiac ischemia. This chapter will equip you with the skills to decipher the heart's electrical language. 13th, chest X-ray and imaging techniques. In this chapter, we'll explore the world of imaging techniques, including chest X-rays and echocardiography. We'll demonstrate how these invaluable tools provide visual insights into cardiac structure, pulmonary congestion, and other relevant findings. Understand the role of imaging in assessing the cardiovascular system. 14th Stress testing. Join us for the ultimate challenge, stress testing. We'll explain the different methods, such as exercise treadmill testing and pharmacological stress testing, and guide you through the interpretation of stress test results. Stress testing helps evaluate cardiac function, diagnose coronary artery disease, and assess exercise-induced abnormalities. 15th Cardiac catheterization. Prepare for an exciting adventure into cardiac catheterization, a procedure used to visualize coronary arteries and diagnose cardiac conditions. We'll explore the procedure, indications, and potential complications, equipping you with the knowledge to understand the role of cardiac catheterization in comprehensive cardiovascular assessment. 16th Laboratory tests for cardiovascular assessment. In this chapter, we'll unlock the treasure chest of laboratory tests for cardiovascular assessment. From lipid profiles to cardiac biomarkers, coagulation profiles, and electrolyte balance, we'll explore how these tests provide valuable information about cardiovascular health. Learn how to interpret these results and their significance in assessing the cardiovascular system. 17th Interpretation of cardiovascular assessment findings. As our journey nears its end, we'll guide you through the process of interpreting cardiovascular assessment findings. We'll help you connect the dots, identify patterns, and form a comprehensive understanding of a patient's cardiovascular health. By honing your interpretation skills, you'll be better equipped to diagnose and manage cardiovascular conditions. 18th Documentation and communication. No adventure is complete without proper documentation and effective communication. In this chapter, we'll explore the importance of accurately documenting cardiovascular assessment findings and effectively communicating with the healthcare team. Learn how to share your insights to ensure continuity of care and improve patient outcomes. 19th Patient education and counseling. Our final chapter focuses on empowering patients through education and counseling. Discover effective strategies for educating patients about cardiovascular health, lifestyle modifications, medication adherence, and the importance of follow-up visits. Enhance your communication skills to support patients in their journey towards a healthier heart. Congratulations, fellow adventurers! You have completed the comprehensive guide to assessing the cardiovascular system step by step. Armed with knowledge, skills, and a sense of exploration, you are now equipped to embark on your own journeys as healthcare professionals. Remember to approach each assessment with curiosity, empathy, and a commitment to promoting cardiovascular health. Safe travels, and may your journeys through the cardiovascular system be filled with discovery and improved patient outcomes.